Hello, students. Welcome to this conversation between myself and instructor Lori Rhodes about detox and cautions and guidance in biofield tuning.
Thanks, Eileen. Yeah, so we want to talk a little bit about this natural process of detox, what it is, what some of those symptoms are, and how we can help our clients to really move through that. So, Eileen, in your experience and in your knowledge, what do you find as detox with biofield tuning? What is that?
Yeah, so there's a whole range of discomforts that people can experience after a session. One of the reasons why we have the motto better out than in, because it's a variety of things. And the way that I've come to see it is that when we have a lot of tension in a particular area in the body, when we've kind of locked down and there's been no breath and no flow in that zone, when we relax that particular area, it's sort of like a neighborhood that the garbage trucks couldn't get to. And now all of a sudden they can. And what is essentially cell waste, I think, kind of gets released from that area and into the body where it needs to be processed, recycled, gotten rid of. And in this, there's emotion, right? We know from the work of Candace Pert, I talk about this in my book, that when we experience emotions, that they form molecules. And if we don't express them, those molecules go and they hang out, and they kind of go into little hidey holes until we do release them. And so this process of releasing what has been held can lead to waves of emotion the next day, where all of a sudden you just have all of these waves of emotion coming up and you might feel really vulnerable. You might want to apply it to something that's going on in that moment, but it's really old stuff that's just releasing. And if we can let ourselves be comfortable with that discomfort, knowing that it will pass and not attach to it, it's usually gone within a day, right? But some people, if they've been trying really hard to hold back these emotions and all of a sudden they start flooding out, it can be alarming and it can be scary. But it's super important to just understand that this is your body is processing and releasing it. So certainly emotional detox can happen. But there can be a physical element as well. I know in all the years that I've been receiving, I've gone through all kinds of wacky detox. And so I think probably the most common one is headaches. People will often get headaches after a session, which can often be mitigated by drinking enough water. So it's super important to underscore the need to drink more water. Um, Fatigue. I know even now, if I have a tune up on one day, like usually the next afternoon, I'm really tired. I'm almost like a computer that needs to shut off and restart, so that freedom to be like, whoa, I'm going down, and give yourself the space to kind of nap and reboot and turn back on can really help with the exhaustion piece. But people we've also seen, and I've experienced, mucus can end up with a lot of mucus coming out. Sometimes pain can get worse before it gets better as it unwinds. People can get rashes that can be kind of extreme. Sometimes people vomit, either in a session, they have to get up and go, or afterwards, which can be a little alarming, but it's a purging, it's a releasing. And I find that the more emotions that people are trying to hold in, sometimes the more dramatic their detox can be. So those are ones that I can think of. Lori, can you think of anything else?
Um, as far, yeah, you talked a lot about exhaustion. A lot of people experience exhaustion. Actually, if folks have experienced symptoms related to a condition or something that they've gone through, even chronically, it can kind of resurface those. Like you were
Mhm.
saying, it can increase pain. So different things that they've experienced. I actually was working with someone today who had a detox response and an old back injury. So places where we've held tension kind of historically can actually flare up, and that's not uncommon either. But again, it really is the bodies and the field and the body are one. So it's one long continuum. So as there's more space and freedom in the field, and those emotions become processed, so the wave comes up, those emotional waveforms come up, they now can reach their destiny and fall away. There's this spaciousness. And that also happens within the cells, like you said. And it's like toxins and digested material. Essentially, as that waveform comes up and goes down, it's been digested. And now all of the accompanying energy within the cells that has been held there, that is really digested material. So it's getting rancid sometimes, actually. It's taking up space within the cell, can now be, let go of. And essentially the cells go to the bathroom. They
Yeah.
release their.
Yeah. That makes me think of another one, the interesting bathroom experience detox that people can
Yes. Yes.
have.
So, I mean, think of detox as toxins or digested material moving out of the body. And the way things move out of the body is by getting really fluid. Like you need to emulsify and make things fluid like. So, oftentimes it'll be snot or, drippy noses, loose stool, sweating. You can sweat to kind of release things. And as these things move out of the body and from this fluid-like state, it can present some of these symptoms.
Yeah, and they can be uncomfortable. And I'll tell you what, like even for Lori and I who've been through this a whole bunch, it's still uncomfortable. So if it's uncomfortable for us and we're very seasoned with this, you can understand that it could be very uncomfortable for a client who doesn't necessarily understand what's going on. So you educating your clients about the potential for this and about what it looks like is super important, right? That's why we created that aftercare sheet that you can give to your clients that, because sometimes after a session they're kind of spun. If you give them a piece of paper to go home, and they're like, oh, I have such a headache. And then they look at the sheet, they're like, oh, that's normal. That's okay, right? So
Yeah.
just really normalizing it for clients. Now, that said, we do have students who really intend very clearly that they don't want their clients to have detox. And some people never do. Some people can have a heavy duty session and just feel good afterwards and not go through the discomfort. So it's definitely not an inevitable thing. I don't like my clients to be uncomfortable, but I know, having been through a lot of detox and then noticing like how much better I feel on the other side. Right? So some people are like me, they're like, bring it on, do the big adjustment, get the gunk out. I'm willing to suffer afterwards. But if you're working with somebody who's older or more frail, or just somebody that you feel like, wow, I really don't want this person to have detox, you can set a very clear intention and say, I'm going to do this session in such a way that their detox is going to be really manageable. And I think people have had a lot of success with that.
Yeah, I do too. I think that your energy follows your intention and the attention that you give it, and you can absolutely apply that container to your sessions, and it does help. Also, on the other side of that, I've seen clients for years without detox, and then all of a sudden a layer comes through and they have this major detox response. So it doesn't you never really know what session may bring it up. So it's always really good to really go over aftercare, post care, and things that you can do to really help with the tuning and to help that energy adjust and flow. What are some of those things that we tell people, Eileen?
Well, definitely hydrate, right? That's super important. It's super, like, the most important thing is make sure that you are not running dry or ending up down a pint. Like, you really want to hydrate. Certainly taking the salt bath really makes a difference. I had that happen last week. I got body work and acupuncture and tuning all in the same week. And I'm like, I don't feel like taking a bath. And I woke up the next morning with it. It's kind of like this feeling of like film on you. It's almost like, oh, that feeling like if I had taken the bath, I wouldn't be feeling this way, right? So there's a definite benefit that we've observed in taking that salt bath. And, some practitioners will keep little bags of salt to hand to their client on the way out the door and say, even if you don't have a bathtub, fill up a basin and soak your feet. Like, don't skip this step because there are consequences to it. You will feel better if you take a bath. And we know that from, skipping it and having the
Exactly.
downside of that. So certainly taking a bath. I feel like going outside, going for walks, getting bare feet on the ground. If somebody's near a beach or a place where they can, walk in the sand, get into water, that's really optimum. And just really giving people permission to follow their body. So if you need to take a nap, take a nap. If you need to pass out at 7:30 and make your kids have cereal for dinner, do that. It's super important to follow your body and take as good care of it as you can.
Yeah, it really is part of the process. It is part of the process. So we do celebrate it. When we check in, another thing to do, especially with a client that you have for the first time, who may have some symptoms after a session, it's good to check in the first 24 to 48 hours, see how they're doing, and speak to them a little bit about the sheet, go over the post-care, things that they can do, and just offer them reassurance that it is part of the process as they move through, and adjust and release this old kind of digested material to create potential and space for the new. That's really what's happening.
Yeah.
And it starts energetic in the field, but it does lead and move into the body with a chemical and mechanical kind of release, which is why the salt bath really works. It's that double layer membrane, that semi-permeable membrane on the edge of the field, at your skin, at the cellular level, that enables that ionic exchange. So things that need to move out that are digested can go out, and that leaves more space and freedom for the things that are nourishing to the organism to come back in. When you have so much digested material, so much locked emotion, so much of that energy, packed in, there's just no room for potential. There's just really no room for anything. And it also stresses our elimination organs out. So the liver, the kidneys, the skin, things that are there and designed in our body to actually eliminate become overtaxed.
Yeah.
And once that has happened, it's almost like a catch up. You can't really get caught up. That's why it's so important to allow these things to pass, and then it'll happen kind of as it needs to in waves, until things are clear.
Yeah.
But that being said, that's why we do make sure and we assess what people's detox pathways look like, right? How encumbered are they when they come to us? We have, you can either speak to a client. We do have our intake form, those forms that really help us to assess what a client's homeostasis is and what their adaptability is. Right. And so we can look at that. And then when we move into working with the client, we have a little bit better focus, and we can work with some precautions, a little bit, and a little bit of guidance, because detox, or the things that we look at and we have discernment around, are sort of revolve around this detox response and how well that person, the person we're working with, can actually eliminate these toxins.
Yes, exactly. And that's why we created the cautions and guidance. So there's certain symptomology or situations that people might be in where their detox is actually going to be maybe more uncomfortable or more heavy duty than we want to put them through. And so what I've found is that sometimes the discomfort doesn't lead to the gains. Right? Because one of the reasons why we happily suffer detox is because we come out the other side and we feel a lot better.
Yeah.
But when in certain conditions, that isn't always the case, right? So this is probably a good time to go through those occasions, right? Lori, you want to pull up that sheet?
Let me pull up this, and we will speak a little bit about really where we use our discernment. It's really all about our discernment, what your scope of comfort level is, what your scope of practice is. We want to stay within the scope of Biofield Tuning. And if you have other modalities that you're an expert in, that's fine. But you want to stay within that comfort zone, really with that intention of do no harm, and being cautious. So yeah, we can start to speak to these, Eileen.
Yeah. All right. Well, why don't we go through, I'll go through one and then you can go through the other. So, so it's important to understand that these cautions and guidance that we're sharing don't come from extensive scientific research. A lot of it comes from my early experience and just kind of a sense like this standard approach that I'm doing, this biofield combing, probably isn't the best thing to do right here. And so we want you to be really mindful of these situations. So we're not saying if you have a loved one who has cancer, you're not allowed to do biofield tuning on them. But we want you to go in really very mindful and sensitive to what's going on, and to just kind of see what's happening. And just so everybody knows, in the United States, you cannot legally treat someone with cancer with anything other than AMA approved protocols. So we would certainly, as practitioners, never have it on our business card or on our website that we treat cancer, even if we developed a way to do it effectively. So just so everybody knows that. But what we found is that once cancer has really advanced in the body, these detox pathways are often very compromised. And so when we start to adjust stuff and give the body the opportunity to purge, it doesn't do it very well. It doesn't do it very comfortably because things are kind of gummed up. Like the body doesn't have the resources to effectively manage this detox process. So that's just something that we really want to be very aware of. And we've also found that that tumors, like if somebody has a tumor, a cancerous tumor, that putting a weighted fork directly on it isn't really a good idea. Even trying to work on tumors that you know are in the body with a fork, there's a sense that it might even amplify or aggravate them. So we just want to be super, super mindful about how we approach tumors. And this is all really important. Like if somebody is no longer in cancer treatment, if they've been determined cancer free, then that's a definite green light. But even understanding that that person is still compromised to a degree, and really when people have been very ill, they really need a multimodal approach. So biofield tuning is not a standalone in a case like this.
Yeah, and that is really the case on many of these with the cautions and the guidance, many of these conditions, that oftentimes it does take a village, right? It takes follow-up, and these things work together because we're working from different different perceptions and different aspects of a held area of tension. Another area that we use cautions and guidance in is with the end of life. It's interesting because if you think about it, biofield tuning is a process by which we bring people back into their bodies, right? It is a body awareness and really becoming, what are you noticing in your body? Come back into your body. And if someone is in active transition, not necessarily end of life, but actively transitioning, they're leaving the body. So you don't want to be offering modalities that are bringing them back into the body. It can confuse the body, it can offset it, and really become a much more disturbing state. For folks that are at end of life and really just depleted in general, moving towards that transition, it can often overwhelm an already depleted system. So you can come in with the intention of calming the system, even just holding maybe a weighted fork, even just around the body, not even intending to do any field combing at all. Maybe just even holding it in the Earth star, the sun star, very gently with the intention of just allowing the flow to kind of soothe and become open. But really, it's an area where the body's doing what it's supposed to do generally. And I think just the intention of calming the body can be okay. And that has worked. Some practitioners I know have done that.
Yep.
Yeah.
Good. Okay. And so then another area is acute illness. So if really anybody has acute anything, except for maybe pain, because we can successfully treat acute pain, but if they're in some kind of acute flare-up or a pretty advanced complex illness, it's really just kind of outside of our wheelhouse. We're not the kind of like, oh, we've tried all of Western medicine and it all failed, and we're looking for a miracle kind of here. This is a wellness practice, and it certainly can help with mild to moderate issues. But when something is acute and complex, again, people really need a team. They really need a multimodal approach. And so if you were working with a team and really addressing the person's individual thing and coming in as gently as you could, acute illness would be okay. But certainly not a standalone, not a standard tuning approach with acute illness.
Yeah. And any of these these areas that we're discussing, you really want to approach slowly. Like, see how the body responds. You don't just want to come in with a field combing or a whole session. You may want to just start with a really gentle earth star, sun star adjustment, or just even maybe holding forks, the Schumann forks at the head, just to kind of help that alpha theta relaxation, really more with the intention of what the scope of this practice really is. Ultimately is allowing the body to relax, really relax enough to do what it's meant to do.
Yeah, exactly.
Okay, you want to talk a little bit about pregnancy?
Sure. So pregnancy is an area where I just always felt like ethically it's sacred. It's not something we want to experiment on, to figure out if it works or it doesn't work or how well it works. So I've really made a point of sort of steering clear of pregnancy. Now, that said, like I just heard a story a couple days ago of somebody who they didn't know she was pregnant. She was trying to get pregnant and did a lot of work on the sacrum area and really helped. And then she ended up discovering she was pregnant, but she'd had like 5 sessions, and she ended up having a beautiful pregnancy and a really easy home birth, and really felt as if that early tuning had really been beneficial, right? I've also helped people to clear their own birth trauma, which has settled the energy in the sacral area and enabled people to get pregnant. So we can certainly help people to get pregnant. And I don't ever want anyone to feel like, oh, I shouldn't have worked on this person because they were pregnant, because it's not that alarming. There were early reports of a couple of miscarriages. One person who was watching a session happen, and another person who'd received a session, and in both those cases, the miscarriages were actually welcome. So it's not like we have a whole history of bad or terrible things that are making us be careful here. It's just that we really appreciate the sanctity of pregnancy. And again, if we're going to work on somebody who's pregnant, we want to approach very slowly, very cautiously, very carefully, with a lot of feedback from them about what their sense is.
Mm-hmm.
There has to be a real solid agreement. And if you ever have any kind of feeling of like, oh, I shouldn't do this, really honor that, even if it's just a small feeling. Whereas if you and the mom, feel really good about it, and you're just like doing weighted forks on the feet or whatever, right? Find a way to approach a situation like this that you feel really good about. So don't say, oh, this is off limits, but this is kind of unknown territory. This is a little bit of a science experiment, and how boldly, how cautiously do I progress here?
Yeah, I think that's so important that you bring that forward, Eileen, that anything that you as a practitioner are uncomfortable, right? If it's like, oh, I'm not sure, I'm uncomfortable. If that's really running through you, you're going to be adding resistance to the field. So it's really best to honor that for you as well, and kind of model that we're going to honor boundaries and honor what our discernment is, and what might be best. And there are other practitioners who may have a different sensation about that, or have a different comfort level, a different expertise that you can refer them to. But yeah, you want to make sure that you're comfortable working with whatever you're working with. Super important.
Yep.
And I've actually worked with pregnant women on their lower back, just with the ease of, with weighted forks, with easing the body and the muscle tension, really focused intention, and have had great outcomes.
Yep.
So you can do
Yeah.
that.
Yeah, it's the field combing and detox thing too that we want to avoid. But there's lots of other ways to administer to people that don't involve heavy duty field combing.
Absolutely. And you can always start with those and see how the body responds, and then
Yeah,
go from there.
exactly.
And then electrical medical implants, things like pacemakers, cochlear implants, Medtronic pumps, neural implants, things like that. They're running off an electromagnetic signal, and it's a very precise signal that's being given to the body so that the body can respond. And the forks do emit a very weak electromagnetic signal, so we really want to be mindful and make sure that we're not interfering with any of those. With the newer pacemakers that are out now, they have shields. They're shielded, because there are so many electromagnetic field waveforms with EMF and all of the Wi-Fi and everything, that they've really changed the way that they make pacemakers in particular. And I've actually worked with Medtronic pumps, like insulin pumps, and different implants, and have had have really kind of actually intended that they kind of get sequestered or isolated within the session so that they're not affected. And it's worked really well. But I'm a nurse, so that's my kind of scope of practice and my expertise. And so I do feel comfortable. But if you don't, that's okay too. You can always refer that out. Also, you can refer them back to their primary practitioner, a primary care practitioner, to ask, is it appropriate with the device I have that I receive Biofield Tuning, which includes the use of tuning forks, and then see what their practitioner kind of says to that and speaks to.
Yeah. Yeah, I've also worked with like the insulin pumps and things like that with no ill effect. I've done sessions on people who've had like pain blocker electronic things in the low back, and I just avoided that area.
Yeah.
And it was fine. It didn't interfere with functioning or anything. So, just again, kind of approach with caution.
Yeah, I don't think I think I would kind of not go around too much of the heart with a pacemaker. I'd work on foot somewhere else. Yeah, I kind of stay clear of that. It just kind of helps that part of me that understands the actual physical nature of the body to feel more comfortable.
Yeah,
Just hanging
exactly.
out over there. Yeah.
Yeah. Good. Okay. So, recent concussion. So, one of the things that I've observed is when people get a good blow to the head, the brain is swollen, and there's also like repercussive things sort of bouncing around in there. And what I've observed is that if you add sound into the mix, again, field combing kind of approach, too soon, it doesn't help. It doesn't. It sort of adds to the chaos in the brain, and so. I found that it's better to let the concussion age a little bit, at least a couple months, maybe 3 months. I think in the past we've said 6. I don't think it needs to be that long. But can you work on their feet? Yeah, you can work on their feet. You don't need to, you can get a lot done through the feet, so you don't need to be up there in the head. But after the brain has settled down a bit and it's not so disruptive in there, then tuning can help with concussions a lot. I've done amazing work with people with old concussions, even things that happened when they were like 2 and fell down the stairs, and it had inhibited, some kind of functioning in the head that we were able to straighten out. So definitely understand that this is something we can treat, but just it's better not when it's fresh, but you still can work on other parts of them.
Yeah, absolutely. Yeah, let that inflammation kind of go down again, because you really want the pathways that are going to assist with reducing that inflammation to be really clear and to be at their full functioning. So you want to give the body some time to do that.
Absolutely.
Morbid obesity is another area where we use our caution and discernment. In suppressed emotions can actually be stored in adipose tissue. And so, the other thing that adipose tissue does, which I thank mine for every day, is if toxins are coming into the body through our food, our water, our air, then one of the great things that your body can do if you don't have the reserves to process it, or there's too much, you're very, very sensitive and there's too much, is your fat cells will take on that toxin and hold it for you. They'll sequester it so that it's not being distributed throughout the bloodstream of the body. And so these more toxins are actually held within the adipose tissue, along with suppressed emotions. And so when the pathways start to open, if there's more held emotions, more held toxins, then more can be released. And so I know that, I hold a little bit of extra weight, and when I have gone through detox processes, not to scare anybody, but my thing is snot and and lots of drainage, and it has lasted for weeks. And generally, like we say with a tuning, it's 1 to 3 days, but in some cases when there is extra held emotion, it can last a lot longer. So we're going to talk a little bit too about the things we can do to help people through that as we move through this list. But just know that it can last longer as well.
Yeah, I had that same experience, Lori, when I first started getting tuned, my very first group of students in 2010. So I'd been doing tune-ups for 14, 15 years and had never received one. And I was very stagnated and compartmentalized and locked down. And right away, I started producing mucus. In fact, I had a whole month. I lost 7 pounds, and I think all 7 of it was mucus coming out of my body as all of that stagnation was releasing. And yeah, it did go for a long time. So it's good that you bring that up, because we do say 1 to 3 days, and that's 95% of what people's experiences are. But there is that 5% where it can be very persistent. And, Lori's been through it. I've been through it. We came out the other side. We felt a lot better. It will come to an end. But continued tuning helps to move it through, too. So that's
Yeah.
just, you don't want to not work on people while they're, exuding goo, because they just want to keep pushing that.
Yeah, actually, let's just talk about that real quick, because this is a good place to talk about that. When you do check in with your client, if they're kind of stuck between you leaving one place and moving into another, that detox is sort of happening. We call that the woods between worlds. You can really help that flow and help things move with the intention of really aligning the integrity of those double layer membranes all throughout the body, with a central channel adjustment, getting that voltage up, helping the liver, the kidneys, the things that are detoxing to have the enough energy to actually work. And so you can offer, as I offer, I don't ever say no charge. I usually say, as a professional courtesy, let me work with you for a short period of time in the ethers, and we'll do a little central channel adjustment and help that flow get going again. So yeah, and after 3 or 4 days, if they're still moving through things, like Eileen said, please bring them back in. Offer a tuning before, not waiting longer, but do it sooner than later to get that energy moving. And
Right. Unless they're acute, unless they're in an acute situation and their sense is that they want to wait a bit. So, obviously every situation is different, but certainly that free, 15-minute, don't call it free, professional courtesy, 15-minute just check in. If people are like, it's 3 days and I'm still, in it, sometimes that little 15-minute check in can really just kind of set people straight.
Yeah. And again,
Yeah,
it's discernment on what's going on. Yeah. You don't want
exactly.
to stress the body out. What about metal toxicity, Eileen? I know you've had some experience with that.
Yeah, so this is kind of an interesting thing. So we're all exposed to heavy metals. Most of us ended up with mercury fillings. I know I've got a whole bunch in my mouth. Never felt like taking them out. Uh, in all in our environment, heavy metals. So why is it that some people sequester heavy metals and have problems with heavy metals more so than other people? And one of the things that I've observed, and I wouldn't say this is true for every single case, but I've observed it in a lot of cases, is that the heavy metal toxicity personality tends to hold on to and resist expressing their anger. So if you think about that, about getting really angry and all of the energy and tension that you have to put in your body in order to hold in that anger, that layer of tension creates a kind of lock that stops the cells from being able to process and deal with heavy metals. Like, heavy metals can't get through that resistance of holding back anger. And so we've definitely seen circumstances where somebody has this kind of personality type, receives a biofield tuning session, and relaxes that layer of tension. And all of a sudden the body is like, starts to just dump the heavy metals out into the system for treatment, recycling, and removal. And that can bring on a whole bunch of symptoms and discomfort. So that's just something to be aware of, that this can happen. And I think that if you're working with somebody who knows they have heavy metal toxicity, it's good to bring another team member into the play who can provide, whether it's herbs or some other kind of support to help get these heavy metals out of the system, right? To just make it more comfortable.
Yeah, absolutely. Yeah, again, a multimodality approach in many of these situations. Okay, and then, we have our weighted forks that we use on the body. So we've just been talking a little bit more about field combing, but there are some considerations that we want to also have discernment around when using weighted forks on the body. One of those is varicose veins. We don't want to put firm pressure or weighted forks directly on those venous areas, those varicose veins, because it does have the potential to dislodge blood clots or just change the integrity of that vasculature. And so you can kind of work around it. around the varicose area without being directly on it, just providing some comfort. But yeah, just really, if you're going to put any kind of pressure around those kinds of vascular areas or varicose veins, to go lightly. The spider veins, the little tiny ones that aren't really popping out of the body, I haven't really noticed any ill effects of using the weighted forks gently over those areas. But again, proceed with caution and really get feedback from the person that you're working with, because it can also be very uncomfortable to work on
Yeah.
those areas.
Yep. Absolutely. Good. And same with if you're using weighted forks on yourself too, you
Mhm.
or your clients. So another area, and this is usually something that would be self-administered, is with dental stuff. So certainly with a sonic slider, we might want to use them around our mouth. And if your teeth are all really solid and good, it's not a problem. But if you've got something like a cracked molar, a loose crown, loose teeth, that vibration coming in is going to loosen things more. So we want to be just very, very aware of our mouth. And if it's solid and good, you're good. But if you're the least bit uncertain, then it's better avoided completely.
Mhm. Yeah. And that's sort of the same thing with fractured bones. We don't want to put an activated fork right on a fracture. First of all, no, you wouldn't be able to. Somebody would jump off the table. It's very painful. That's how they actually use tuning forks to diagnose fractures in bones. So you really want to be very, very cautious in those areas. You can go around the area to relax the area, add some blood flow, what we call sort of circling the dragon, moving around the areas with real discernment, caution, and lightly first. Moving those. But again, the inflammation has to go down. We need to give that time, at least 3 months, often after a fractured bone, before we're going to work real closely to it. And we don't want to interfere with the natural process that's already occurring as well. Things merging together and kind of melding. A fork can actually disrupt that with vibration. So we want to be real careful.
Yeah. That said, you can hold a fork over the fracture.
Yes.
And that doesn't seem to do any harm and actually might help the body with feedback to knit itself better. So it's okay to hold an unweighted fork or even a vibrating weighted fork over where the fracture is, but not directly on it.
Yeah.
Okay, and then metal implants. So those are screws, rods, plates, things like that. I have never really ever had a problem with that. Hip replacements, knee replacements, screws, like I've never ever had a problem. I mean, obviously, if somebody's got 13 screws in an ankle, you're not going to come in with two weighted forks and with boots on either side of that area and start vibrating it, right? So that's just really common sense. So really, with most of these metal implants or joint replacements, you just proceed as usual. Certainly be careful around scar areas and get feedback from your client, but you don't need to have trepidation about working on these things for the
Yeah.
most part.
And certainly you can do field combing with metal implants. Does not affect them at all.
Not at all.
Yeah,
Yeah.
it can work really well. Actually, most of the varicose veins, the dental anomalies, and again, fractured bones and metal implants, the field combing and holding the fork around the area is fine. We
Yeah.
haven't seen any other reactions from that or responses that are ill advised. And then
Mhm.
what about group sessions, Eileen? What have you found with that?
So with group sessions, we've done hundreds of these over the years, and certainly thousands and thousands of people have listened to them. We've had very, very few reports of adverse or extreme effects from them. So the things like pacemaker, pregnancy, cancer, all of those that we're kind of careful around, one-on-one in person, seem to be much more diffuse in a group session and much more likely to cause problems. Now, just because they haven't been reported to us doesn't mean that they haven't happened. And I think that, sometimes people can have strong reactions to them, but nothing that, that if you, for example, if you have clients and you're letting them know about the free sessions that we've got, if they want to augment, what's happening, they want to go, oh, there's alchemizing pain, or that 144 strand free session, that you can, for the most part, I feel, freely offer them to people. And, if somebody is a little acute or is a little consideration, just really leave it up to them. It's up to them to listen to it and to feel into it and to determine if it's appropriate, if they can manage it. But for the most part, these seem to be very safe, I would say.
Yeah, great. Awesome. Yeah. And just to kind of wrap this up, as far as cautions and guidance go, as you can see, most of the discernment and your choices around what you're going to work with and how you're going to work with it do kind of pull in that concept of detox. What can the body handle? What reserves are there? Right? What are can the body actually eliminate this digested material with ease and with, not a ton of discomfort? So you're really wanting to look at that. That's part of it. And then also what your scope of practice is, what your level of comfort is. You never want to work with something that you're not that you don't feel comfortable working with or have the knowledge to do, because again, you're adding resistance to the field and it's just not appropriate. It's just not appropriate. It's not ethical to do that. To really work with a team when it's appropriate, right? Certainly, I know that massage can also really help with detox symptoms, relieving the cell, helping the cells to push that digested material out and really having that physical manipulation. It's awesome. I know, Eileen, you usually kind of do a tandem
I do.
tuning massage.
I do. And this is an important fact. Like if you have somebody and they do like 3, 4, 5, 6 biofield tuning sessions, they have got to go get some body work in there. It's very important to follow up a lot of energy work with visceral manipulation, craniosacral, myofascial release, straight massage. Like that is very much part of my own wellness practice, is that I get regular massage because I'm getting regular tuning all the time. So it's good to have a network of providers that you can refer people to and say, okay, you've had 4 sessions. I think that it's really, let's take a break from tuning. You go get some body work and then we'll come back and do some more. It's really supports the body in that detox process and in just integrating all the work into the physical level.
Exactly. And then we do have our forms available for you to help with clients. The things that will help integrate that post-session form. We'll speak to a client about what detox is and what they can do. Our intake form will help you gather information for your own discernment. The disclaimer also allows the client to know what biofield tuning is and isn't. We're not curing anything or treating anything, right? We're staying within our scope of practice of offering relaxation to the body so that it can basically fix itself. And then really making sure that you are checking in with your client, that post-care, and celebrating this as a normal, natural process, the detox when it happens, right? Because it's part of the process, and it's really going to create that space for new potential, for new things to happen. And the body really does feel better once they get through that. But there are things we can do to help.
Yeah, absolutely. Absolutely. And when in doubt, always err on the side of caution. That's what I've always done. Lori does the same thing. So, just or ease in very, very slowly.
Yeah.
Good.
So if you have any questions, save those up for our classroom discussion, and you can speak to your teachers about that. Any other curiosities you have, and the full discussion can ensue from there.
All right. Okay, great. Well, happy tuning, everyone.
Thanks, Eileen.
Yeah, thank you, Lori.